Um, my question is healthcare. I was almost in the Guinness World Book of Records for being the earliest baby born in 1986. I was born 23 weeks early. I was a triplet and they didn't make it. And I work within the community. I've given a speech in Westchester County on my life growing up being born early. And people talk to me after this event, and they say, I have a child being born early, I'm going bankrupt.
Yeah.
And they're walking away, and they have nothing. And all they care about is they just want their child to be born as healthy as it can be, but they can't focus on that. It's focus on these mounting healthcare bills. And I don't know why in this country we don't have a national healthcare service. I don't see the issue why we just can't put politics aside, take some money from the overbloated defense budget, and just put a healthcare program.
Yeah.
It's awful. And I have Republican friends that I talk to, and I give them my story, and they don't seem to care. And it's like, healthcare affects everybody. Yet these same Republicans, their hands are out for Social Security. Their hands are out for Medicare, Democratic programs. And also, I want to say thank you for your eloquence and your sophistication. My grandfather was in World War II, and he was a Nazi hunter after the war, and he was in the CIA, and he was thanked by John F. Kennedy.
Oh, wow.
And you really remind me, and I know that you remind him of that. So thank you.
Thank you very much. Yeah. Thank you so much. Appreciate it. Yeah. Yes, I'd be very happy. I'll sign it right after this event. So first of all, thank you for having the courage to share your story, to bring us all in. That's what I hope to be able to do in this campaign. The statistics, the numbers, sometimes the facts can become an abstraction for people. When we all listen to you and meet you, we're brought into your story and we care about you. Y no me importa, we don't care if you're a Republican or a Democrat or an independent or whether you can even vote at all. We just want to be there for you. That's my impulse, at least. That's what I'm compelled to do. And what you describe makes so much practical sense to make sure that that expecting mother can focus on the well-being of her child, or that parent that we just met in Amherst who talks about her son with autism and the fact that she wants to make sure that there are more state and federal supported services because they're paying $10,000 out of pocket for his care. They shouldn't have to do that in this country. She says, thank God that I have the means to, but there are other parents who do not. In my home state of Texas, you tell me if it's like this in New Hampshire, the largest provider of mental health care services is the county jail system. The largest inpatient mental health care facility is the Harris County Jail. We pay $110 a night to keep someone locked up who, for their schizophrenia or bipolar disorder, got arrested on purpose to get care in the one place that was going to be guaranteed. Imagine the savings we would realize with world-class outpatient mental health care, and the fact that we now unlocked that person, literally freed them to live to their full potential. We know that we have a maternal mortality and an infant mortality crisis in this country. Cynthia, microphone. Yeah, all right. We know that we've got a maternal and an infant mortality crisis in this country. Maternal mortality, 3 times as deadly for women of color. The infant mortality disparity between white America and black America today is greater than it was in 1850, 15 years before the abolition of slavery. So, to your point, what if we invested in world-class, universal, high-quality healthcare for every American, and then ensured we also invested in home healthcare visits, doulas, midwives, make sure that that's covered, more mothers survive, and then this, healthcare is primary healthcare, mental healthcare, but healthcare is also every woman making her own decisions about her own body and having access to the care that makes that possible. So we can do all this. I'm with you. And let's not write anybody off, regardless of their party. Bring everyone into the solutions. That's how we get it done. I'm going to look for you afterwards so I can sign this for you, okay?